Well, Howard, the problem, it always, the discussion seems to always center on disinfectants. But I'll tell you honestly, in talking about this situation, I feel there are three levels. First of all, your immune system to take better care of ourselves, particularly getting enough sleep. Secondly, was the air quality, and years ago we studied this quite in detail. There is an organization, we refer to it as ASHRAE. It has to do with air quality in general and all types of buildings, how much circulation and so on should be there. And again, dentistry is a problem because of the aerosols that we can't help but create. So the question is how to clean them up. So it has to do, believe it or not, with something as everyday important as your high velocity suction. Learning to suction properly can take care of a huge percentage of those aerosols, over 90% of them. And by properly, what I'm saying here is that the suction tip needs to be opposite the instrument, whether it's a water-cooled handpiece or whether it's an ultrasonic scaler or whether it's something like a Profi jet. And we don't operate that way. Usually the assistance will come in from the top and actually suction the coolant water and so on off before it ever hits the tooth. But what you want to be, if the doc is operating from the facial, that suction needs to come from the lingual to pull that water right across the tooth. So,
and with regard to Xyrus and our Isolite system, do you use us with that, or is that something you also push off?
Yeah, absolutely. I mean, right now there is concerns that the aerosols in dentistry could potentially be a route of transmission, although there's no known research indicating that. And I think that before we get all crazy with any new regulations, that we have to really take a close look at the route of transmission of the disease. That being said, I mean, I don't want to, potentially put myself or my patients or my staff at risk. So we're trying to minimize the aerosolization of fluids in our practice. I think Isolite is one of the tools that people can use, and it's an excellent tool to help keep the aerosols away. And I can't imagine going through this crisis without it.
With regard to things like spatter or with aerosols, do you see it helping out in kind of helping minimize that?
Oh, absolutely. And obviously, in the office, I cannot imagine a dentist that have not at least seen the product. It helps obviously because of the constant suction. In the operating room, for me, is and even though obviously I have a very important control in terms of the environment, being able to protect the airway and keep everything dry and not on my face, on my mask and my glasses when I'm in with the patient, it's priceless. And the fact that it's disposable. I know that we have talked about doing certain things that you can autoclave. I personally, I like the fact that it's a disposable product, that you don't have to worry about
But
it.
when you have the Isolite wrapping around the area, the contaminated area where you have a handpiece going, it's sucking all those aerosols down the high-speed suction when you have them going out into the operatory. And I've seen some studies where they compare like Isolite uh, to a rubber dam for isolation and things, and they always talk about the reduction in aerosols. And I am not a that's not my area of expertise, but I do know that at this time when there's you want to reduce the aerosols. That's I've seen how if you are seeing patients, if they have like a peri emergency, I've read to not use an ultrasonic right now and things like that. If you are creating aerosols, I think having something to reduce the amount like an Isolite is a phenomenal idea.